Well, thank you. Let me first begin by thanking our witnesses and all the members, Republicans and Democrats, for being here today. You know, it's unusual to convene a hearing in D.C. during a district work period, but on this issue there is no time to wait. I was likewise glad to see the President get off the campaign trail yesterday to finally focus on the crisis. People are scared. We need all hands on deck. We need a strategy, and we need to protect the American people, first and foremost. It's not a drill. People's lives are at stake, and the response so far has been unacceptable. As chairman of this committee, I want to assure the witnesses that we stand ready to support you in any way to keep Americans safe. But we're going to hold your feet to the fire on getting the job done and getting it done right. Both the U.S. and the global health community have so far failed to put in place an effective strategy fast enough to combat the current outbreak. The CDC admitted more could have been done in Texas. 2 healthcare workers have become infected with Ebola, even as nurses and other medical personnel suggest that protocols are being developed on the fly. And none of us can understand how a nurse who treated an Ebola-infected patient and who had herself developed a fever was permitted to board a commercial airline and fly across the country. It's no wonder that the public's confidence is shaken. Over a month ago, before Ebola reached our shores, we wrote HHS Secretary Burwell seeking details for the preparedness and response plan here at home and abroad. And it's clear whatever plan was in place was insufficient, but I believe that we can and must do better now. We need a plan to treat those who are sick, to train healthcare workers to safely provide care, and to stop the spread of this disease here at home and at its source in Africa. This includes travel restrictions or bans from that region beginning today. Surely we can find other ways to get the aid workers and supplies into these countries, and from the terrorist watch list to quarantines, there are tools used to manage air travel to assure public safety. Why not here? We can no longer be reacting to each day's crisis. We need to be aggressive and finally get ahead of this terrible outbreak. The American people also want to know about our troops and medical personnel who are courageously headed to Africa to treat the sick. How are they going to be protected? We want to know that healthcare workers here in America have the training and resources necessary to safely combat that threat as well. So it's not just the responsibility of the U.S. The global health community bears the charge to finally get ahead of the threat, develop a clear strategy, train all of those involved in combating this disease, and eradicate the threat. We have all heard the grave warnings that this is going to get worse before it gets better. People are scared. It is our responsibility to ensure that the government is doing whatever it can to keep the public safe. Diana DeGette and I have partnered together on the 21st Century Cures Initiative to help improve the research and speed the approval of life-saving medicines and treatments. And while much attention has been paid on how this effect can help with diseases like cancer and diabetes, this same reforms have to help us in the development of treatments for deadly infections like Ebola. We are partners in this effort to save lives. I yield